you ever wondered what the wound care nurse does for people with venous stasis ulcers or edematous legs? Well, I kind of figured you did, so I put together this presentation as to explain to you what the purpose and the application of an Una boot is. At the end of this presentation, you'll be able to describe the purpose of an Una boot. You'll also be able to state the potential outcomes of an Una boot, the indications, contraindications for using one, as well as the supplies needed, and how to apply an Una boot. The purpose of an Una boot, first off, is to apply continuous and gradual pressure to the lower extremity to aid in blood flow. It is also used to help with venous stasis ulcers, which are ulcers that are obtained because of incompetent veins or valves in the veins. According to the Journal of American College of Wound Care Specialists in April 2013, it was said that chronic venous stasis ulcers are not only costly in the economic sense, but also costly for the quality of life. There was also a study done. It was called Evaluating the Effectiveness of Customized Una boot when treating patients with venous ulcers. That was published in 2013 as well. It basically said that the Una boot helps aid in the healing of venous stasis ulcers in a shorter period of time. Alright, so the indications for an Una boot is to be used on the lower extremities, and it is also used for venous stasis ulcers. The lower extremity edema, as well as venous stasis ulcers, both caused by incompetent valves in the veins. It is contraindicated by mixed venous and arterial ulcers. The arteries of your body can also have incompetent valves as well, so this is a contraindicated on that. Edema are ulcers associated with diabetes, as well as edema associated with congestive heart failure. Now these are all, this is per the Swedish American Home Health Policies and Procedure Manual that was printed in 2011. Now the supplies that you will need will be a Una boot dressing, and also like a Coban type of dressing. Any topical dressing that the doctor may have ordered to be applied to like the venous stasis ulcer. You'll need soap and water or a mild cleanser, blunted scissors, as well as gloves. Okay, first off, when you first get your patient, what you're going to do is you're going to remove the old Una boot first. You're going to find out where the ulcer is, if they have one. If it's on the lateral side or the outside of the leg, you're going to want to make sure that you cut on the medial side or the inner side of the leg. Cut all the way up, you take it off, and then what you're going to want to do is wash the leg and the foot, dry it real well, apply the topical dressing if there is one indicated, and then you're going to go ahead and apply the first layer of the Una boot. Now what this layer has, it is saturated with calamine, and it also has zinc in it. Zinc is a bacteriostatic type of component that helps aid in the healing of the ulcers. You're going to loosely wrap the foot with this first layer, and it's kind of like it looks like an ace bandage kind of thing, that kind of wrapping. So basically what you're going to want to do is you're going to want to start above the toes. So for example, if this is your foot, you're going to have the patient's foot like this. You're going to start above the toes, and you're going to want to start on the top. Don't start on the bottom, because if you start on the bottom, you can potentially give them another wound. So you start at the top and you wrap around, and you do that you just wrap it loosely and try to keep all of the wrinkles and things out of it. And when you're finished, you're going to want to stop about 1 to 2 inches below the knee. Cut that away, cut off the rest, and just kind of form it to their leg. Make sure that it's, it doesn't have any wrinkles or anything like that. Next, you're going to apply the co-band or the elastic wrapping, and you do that exactly the same way as you did the Una boot. Except for this one, you're going to have a 50% overlay, which means you're going to go 50%. So if the co-band is here, that when you wrap it around, you're going to want to, the second layer is going to go 50% up on this one. And you're going to also want 50% tension. So what that means is you're going to go ahead and wrap it, you're going to pull it 100% and go back halfway. And then continue to wrap until you make it up to the top of where you ended the Una boot. And that would be the conclusion of your application. So just to kind of bring it all together, basically the reason for an Una boot is to help aid in blood flow and help cure those ulcerations. And you now know the supplies needed, the indications and contraindications, as well as how to apply the Una boot. So now when you see that person that has either an Una boot on, or you see them with an ulcer or edema, you're going to know what to do.